Good morning, Mr. Lee. I've gone over your recent abdominal CT scan and lab results with you over the phone. Do you remember what I said?
我唔記得，人越老記性越差。
Your CT scan showed thickening of the colon wall near the sigmoid region, fat stranding, and several inflamed diverticula, which are hallmark findings for diverticulitis. The CT scan helps us differentiate it from conditions like foodborne illness, appendicitis, or colitis. That means you've been officially diagnosed with diverticulitis.
你可唔可以解釋下係咩嚟㗎？
Diverticulitis refers to inflammation, and sometimes infection, of small sac-like protrusions called diverticula that develop in the wall of the colon. These pouches are common in older adults and are typically harmless unless they become inflamed, which is what has happened in your case. The presence of diverticula alone is known as diverticulosis, and it's very common, especially in people over the age of 40. Most people with diverticulosis don't have symptoms and never develop complications. It's when those pouches become inflamed or infected that they turn into diverticulitis.
氣室點解會出現？
Diverticula usually form when weak spots in the wall of the colon are exposed to increased pressure over time. Often due to chronic straining during bowel movements or a diet low in dietary fiber. This pressure causes small pouch-like protrusions to develop, especially in the sigmoid colon. Aging and family history are also known risk factors.
都係我家庭醫生嘅錯，我同佢講咗好多次我有慢性便秘，但佢只係叫我自己去買啲非處方嘅軟便劑，完全冇正視我嘅問題。如果呢件事惡化落去，我真係要告佢。
I can hear how frustrated and upset you are, and it's completely valid to feel that way when your concerns aren't fully addressed. That said, right now our priority is making sure you recover properly and avoid any complications. Once you're stable, we can talk more about prevention, and if needed, we can coordinate with your primary care provider to ensure you get better long-term support.
點解會發炎或者感染？係點樣形成嘅？
Often, it's due to a blockage in one or more of the diverticula by stool, undigested food particles, or even trapped bacteria. This can lead to increased pressure in that section of the colon, poor blood flow, bacterial overgrowth, and ultimately, localized inflammation and infection.
咁就解釋到點解我左下腹會有陣刺痛啦。
Exactly. The most classic symptom of diverticulitis is acute, persistent pain in the left lower quadrant of the abdomen. You also had a mild fever and high white blood cell count, both of which are common indicators of systemic inflammation or infection.
我之前長期便秘，你話嗰啲係導致我出現氣室嘅原因，但我唔明點解我最近反而開始有腹瀉。
Actually, it makes perfect sense. Chronic constipation is a key factor in the formation of diverticula, but once diverticulitis develops, it can lead to a change in bowel habits. Diarrhea is actually a common symptom during an acute flare because inflammation irritates the colon and speeds up transit time.
我呢個情況會唔會有生命危險？我嘅女幾個月之後就生啦，我要睇我嘅孫女。
In most cases like yours, what we call uncomplicated diverticulitis, it's not life-threatening. But if it progresses into complicated diverticulitis, it can lead to serious complications like abscess, perforation, peritonitis, or even sepsis. That's why timely treatment is so important.
治療方案係點？
Yes, the reason why you are here is to talk about treatment plan. We'll begin with non-surgical treatment. That includes a short-term bowel rest, meaning you'll start with a clear liquid diet to reduce colon activity, and a 10-day course of broad-spectrum oral antibiotics, typically ciprofloxacin and metronidazole, to target gram-negative and anaerobic bacteria.
我唔想因為呢個問題要入醫院，我屋企有好多責任要處理，而且我自己開咗間五金鋪，平時淨係得我一個人打理，我要係到唔返工，鋪頭就冇人開門，冇人睇貨，又冇人招呼啲熟客，依家請假會對生意影響好大。講真，我喺醫院都會覺得好焦慮，除非真係好嚴重，否則我唔太想住院。
Not at this point. Because your vital signs are stable, you're able to eat and drink without vomiting, and there's no sign of systemic infection or complications. Outpatient management is appropriate. We'll monitor your symptoms closely, and if there's any sign of worsening, you'll need to come back immediately.
氣室炎算唔算係一種慢性病？即係話啲症狀會一路喺度，直到完全醫好，定係屬於一種間歇性嘅情況，好似發作一下又停一陣咁。
Diverticulitis itself isn't considered a chronic disease in the traditional sense, but the underlying condition, diverticulosis, is chronic. The inflammation, which is what we call diverticulitis, usually comes in episodes or flare-ups. Some people have one episode and never have it again, while others may have recurring symptoms over time. That's why prevention and long-term management are important after you recover.
咁如果我食足一星期抗生素，係咪代表我嘅痛楚同唔舒服就會消失？
In most uncomplicated cases like yours, yes, symptoms usually start to improve within a few days of starting antibiotics, and by the end of the 10-day course, the pain and discomfort are often gone. But everyone responds a little differently, so it's important to finish the full course and let me know if anything gets worse or doesn't improve.
有冇咩方法可以減低復發風險？
Once you recover, the best preventive measures include adopting a high-fiber diet with plenty of fruits, vegetables, and whole grains, drinking adequate water, staying physically active, and maintaining a healthy weight. Avoid smoking as it increases the risk of complications.
其實我記得以前有人講唔可以食堅果、種子或者爆谷，但我都唔知係咩病先要避開啲嘢。依家我想問，呢啲同氣室炎有冇關係？
That's a really common belief, and for years, people were told to avoid nuts, seeds, and popcorn because it was thought they could get stuck in the diverticula and cause inflammation. But more recent studies have shown there's no clear evidence linking those foods to diverticulitis flare-ups. So, unless you personally notice they trigger symptoms, there's no medical reason to avoid them.
抗生素真係一定有效。以你經驗，有幾多病人食抗生素就痊愈？如果冇效又點算？
In cases like yours, antibiotics are very effective for most patients. Based on my experience, the majority of patients improve within a few days and recover fully. But no treatment is guaranteed. If your symptoms don't improve or get worse, we'd reassess with imaging to check for complications and adjust the treatment if needed.
如果我淨係食抗生素，會唔會只係治標唔治本，只係避免再發作，但唔係根治個問題？有冇方法可以從根源處理？
I understand what you're saying. The antibiotics help manage the current inflammation and infection, but you're right, they don't remove the diverticula themselves. Since diverticulosis is a structural change in your colon, there's no medication that can reverse it. However, we can focus on long-term prevention, a high-fiber diet, staying hydrated, regular exercise, and maintaining a healthy weight can significantly reduce the risk of future flare-ups.
有冇其他方法可以根治？如果有一種細規模、風險唔大嘅手術可以解決問題，我都唔介意做，我只係唔想做一啲大型又高風險嘅手術。
There is a surgical option called a segmental colectomy, where we remove the part of the colon that has the diverticula, usually the sigmoid colon. It's typically recommended only if someone has recurrent diverticulitis, complications like fistulas or strictures, or if their quality of life is seriously affected. When done electively under stable conditions, it's generally safe and done with minimally invasive techniques. But since this is your first episode, we usually wait to see how your body responds to treatment before considering surgery.
氣室炎會唔會變癌？會唔會之後惡化成其他嚴重疾病？
No, diverticulitis itself does not turn into cancer. However, the symptoms of diverticulitis and colon cancer can sometimes look similar, especially things like abdominal pain, changes in bowel habits, or rectal bleeding. That's why, after the inflammation settles, we usually recommend a colonoscopy, just to rule out any other underlying issues, including cancer.
你會幫我安排大腸鏡，係唔係？另外，抗生素係唔係要即日去藥房拎？
Yes, I've already sent the antibiotic prescription to your preferred pharmacy, so you can pick it up today and start the medication as soon as you get home. As for the colonoscopy, I've already put in the order. Someone from the scheduling department will contact you in the next week or so to set up a date. Just keep in mind, the procedure itself is usually done about 6 to 8 weeks after recovery.
明白。抗生素會唔會有副作用？
You might experience mild side effects like nausea, diarrhea, dizziness, or a metallic taste in your mouth. Rarely, antibiotics can cause allergic reactions or Clostridioides difficile infection. So if you develop severe diarrhea or abdominal cramping, call us right away.
我食完抗生素之後應該唔會再腹瀉啦，會唔會又變返之前咁便秘？如果唔想咁樣，係唔係要開始食多啲高纖嘅食物？
You've got the right idea. The diarrhea you're experiencing now is related to the inflammation from the diverticulitis itself, and once the infection clears up, that should go away. But since you have a history of constipation, it's very possible that it could come back once things settle. To help with that, I'm also prescribing a gentle stool softener for short-term use. And long-term, switching to a high-fiber diet, drinking plenty of water, and staying active will be key to keeping your bowel movements regular and preventing future flare-ups.
明白，多謝你。下次見你就係做大腸鏡嗰陣。
Not necessarily. If everything goes smoothly, the colonoscopy will likely be handled by another gastroenterologist, Dr. Khan. You see him before, but if you have any issues while you're recovering, like worsening symptoms, new pain, or trouble with the antibiotics, I want you to reach out right away. Otherwise, we can schedule a follow-up visit after you finish the antibiotics, just to make sure everything has been resolved before the colonoscopy.
我而家去前台，係唔係？
Yes. Take care.